Today, we're talking about one of the biggest challenges in global health. It's a silent epidemic that touches literally every country on Earth. But we're also going to look at one of the most practical solutions ever designed to fight it, the WHO's PEN package. Think of it as a simple, powerful toolkit designed to save millions of lives. Let's dive in. So, to really get why this toolkit is such a big deal, we have to start with this number, 41 million. That's how many people die every single year from what we call non-communicable diseases, or NCDs. To put that in perspective, that's more than the entire population of Canada. Gone every 12 months.
And this chart? It just drives the point home. NCDs aren't some small niche problem. No, they're responsible for a staggering 71% of all deaths, globally. I mean, we're talking about long-term conditions that are becoming more and more common, which is exactly why they call it a silent epidemic. This isn't just a health issue. It's a global crisis hiding in plain sight.
Okay, so here's our game plan for today. First, we'll take a closer look at this so-called silent epidemic. Then, we're going to unbox the toolkit that's designed to fight it. We'll peek inside at the specific interventions, see how plans actually get turned into action on the ground, and finally, we'll connect the dots to understand why this matters for all of us.
First up, the silent epidemic. What in the world are we actually talking about when we say non-communicable diseases?
So here's the crucial thing to understand. NCDs, or chronic diseases, are conditions that stick with you for a long time. You don't catch them like you catch a cold. They develop from a whole mix of things: your genes, your body, your environment, and, this is a big one, your behaviors.
Now, the WHO really zooms in on four major players that cause the most damage: cardiovascular diseases like heart attacks and strokes, all kinds of cancers, chronic respiratory diseases like COPD and asthma, and of course, diabetes. And here's the truly tragic part. The vast majority of premature deaths from these diseases happen in low and middle income countries. So you're faced with this absolutely massive global problem. What's the solution? Well, this is where the WHO's PEN package comes into play.
PEN actually stands for Package of Essential Non-Communicable Disease Interventions, and its real genius is in how simple and practical it is. It's basically a curated list of the best bang-for-your-buck actions that can be taken right at the primary healthcare level. This empowers local clinics and health workers to make a huge difference, even when they don't have a lot of resources.
You know, what's really cool about this is that PEN isn't some dusty old document sitting on a shelf. It was first introduced way back in 2010, and it's been updated and refined ever since, adding new evidence, new tools, and best practices. It's a living, breathing strategy that actually adapts to what works in the real world.
All right, so what's actually in this toolkit? Let's pop the hood and take a look inside the package.
Okay, so you can see right away, this thing is packed. It's got clear, simple protocols for managing the big ones: heart disease, diabetes, and respiratory conditions. But it also covers things like early cancer diagnosis, lifestyle counseling, and even palliative care. To make this feel a little more real, let's just do a quick case study for cardiovascular disease. So let's just imagine a patient walks into a local primary care clinic. How does the PEN package help a health worker figure out their risk of a heart attack or stroke? Well, it gives them a simple, structured protocol to follow. It all boils down to four really clear steps. First, you ask the patient about their history and lifestyle. Things like smoking or what they eat. Second, you assess them with basic exams, like taking their blood pressure. Third, you use these brilliant color-coded charts from the WHO to diagnose their 10-year risk of something bad happening. And finally, based on that risk level, you treat with the right mix of counseling and essential medicines. It's a super clear pathway from just having a conversation to taking real action. Of course, a great plan is pretty useless if it just collects dust on a shelf. So let's talk about how countries actually take this package and bring it to life. The WHO provides a clear roadmap for this too. And it's not about just dropping a manual on someone's desk and walking away. No, it's a whole process. It starts with getting everyone on board: government, community leaders, you name it. Then you look at what you already have, create a model that fits your community, train your healthcare workers, keep an eye on how it's going, and then you plan to scale up what's working. It's a really methodical approach to making systemic change. So for our last section, let's zoom the camera all the way out. Why is this package so much more than just a set of medical guidelines? Well, this is about the path to universal health for everyone.
The ultimate goal here, the big prize, is something called universal health coverage, or UHC. And all that really means is that every single person should be able to get the quality health services they need without it absolutely destroying them financially. The PEN package is a fundamental building block for UHC because it makes essential care for the world's biggest killers affordable and accessible, right there at the community level.
And this slide, wow, it just makes the economic argument crystal clear. It is so much smarter and cheaper to invest a little bit in early detection, risk screening, and basic medicines at a local clinic than it is to pay for the catastrophic costs of late-stage treatment like emergency surgery, amputations, or dialysis. Prevention isn't just good medicine, it's just plain good economics.
And this quote from the WHO, man, it gets right to the heart of it. It shows you the immense tragedy that most of these deaths are avoidable. But it also screams with urgency. Without putting tools like the PEN package into action, we're going to fail to meet our global promise to reduce these premature deaths.
Which leaves us with this final critical question. We have the toolkit, we've got the roadmap, we know it works. The real challenge then isn't about knowing what to do anymore. It's about getting it done. So what is that single most important next step, whether it's political will or funding or training, that will finally turn this brilliant plan into a universal reality for everyone?